Thank you very much for having me here today. I'd like to start off by acknowledging that we're on Indigenous traditional land. The City of Regina is on Treaty for Indigenous Land. So in the spirit of truth and reconciliation, I acknowledge that. And I'm here today to give you a very broad overview of what is One Health. And One Health is very broad, so this talk is gonna go through a lot of different topics, so I hope you don't get whiplash. Part of the reason why I'm up here is I'm a veterinarian, but I did a Master's of Public Health. And I did that at New York University, where all my classmates had to have an advanced degree in work experience. So there were a lot of human doctors in the crowd, and social scientists and lawyers, and I was the only veterinarian. So I really lived and breathed One Health. Nobody knew what One Health was. And a lot of people hadn't really considered the impact that animals have on human health and human livelihood and everything. So One Health it's a new-ish way, I say, of thinking, because it's not new. It's been around for a very long time, but it's getting a second wind right now. And so One Health is, at the most basic core, the interconnection between humans, animals, and the environment. So how do those components interact and impact each other? And so why One Health? So if you don't think that animals are that important, 60% of human infectious diseases come from animals. At least 75% of the emerging diseases are from animals. 5 new human diseases occur every year, and at least 3 of these are from animals. And 80% of the bioterrorism agents are animal origin as well. So an interesting thing that happened in New York was my professor gave me a list of topics, to do my term paper, so I gave him a list of zoonotic diseases. At the very bottom of the list was anthrax, because it's a cool disease, but there's cooler diseases, I thought. And he was like, anthrax, that's a bioterrorist agent. If you can somehow link that to animals and the environment, then go to town. So I think, okay, well, I guess that's where I'll start then, with anthrax. So. And he marked the papers based on how much he learned, and he gave me an A++. So it was pretty funny. So I also like this triad. This one shows sort of, again, the human ecosystem and animal health, but also prevention, detection, and response. Those are the sort of key themes of One Health. One Health works in different contexts, so it's important to remember culture, economics, and the global context, and global is local and local is global. So if, what happens here in Saskatchewan is reflected globally as well. And then all around supporting the social determinants of health, which as a veterinarian, I didn't know about the social determinants of health really until I went and did my Master's of Public Health. It's just not something that we're trained in. We're very science and numbers. So I thought we'd just quickly go down a little bit more about the drivers behind each of these. So when you think about human health and the things that are changing that, we have extreme population growth right now, so we're at almost 8 billion people in the world. It's a global village. We're more mobile than ever, whether by choice or through forced circumstances, through climate refugees or migration. And the social determinants of health, we're beginning to realize how important those are. So if you don't have money to pay for basic food, then it's very hard to be healthy, because you're struggling with all these other things. And animals, as I mentioned, a lot of human pathogens come from animals, and that's because animals and humans coexist so naturally and so completely. And the human-animal bond is really important when you look at the role that livestock play globally. For a lot of subsistence farmers, they depend on livestock for their nutrition, for economic security, and also our pets. So animal medicine, veterinary medicine is advancing, and your pet can get excellent quality of care. And then the environment. So we all know about climate change, land use change, and loss of biodiversity. So when we have ecosystems changing and becoming more agriculture or mining, and it disrupts the ecosystem, the biodiversity is lost, we lose that buffer. It brings wildlife in closer contact with humans and the domestic animals, and then that allows for disease spillover to occur. So this is Rudolf Virchow. In his quote, which is quoted often in the One Health world, there are a lot of what is One Health talks and webinars and things online that you can look at. And this quote's almost always there. Between animal and human medicine, there are no dividing lines, nor should there be. The object is different, but the experience obtained constitutes all medicine. So he was a very interesting guy. He was a physician, but also interested in animal health, obviously, and he termed the corn zoonoses. So in case you don't know, a zoonosis is a disease that goes from animals into humans. He also did the life cycle of trichinella in swine and the zoonotic impacts that could have on humans. And he was in an argument with somebody and was challenged to a duel, and he could choose his weapon of choice. So he chose pork sausages, a cooked one for himself and one uncooked one full of trichinella larvae for his opponent, who refused the challenge because it was too risky. And it goes back even further than that, back to Hippocrates and his on airs, water, and places, and the idea that the environment impacts public health. It's something so basic but can be forgotten. And then in the 70s, Calvin Schwabe developed a really interesting veterinary preventive medicine rotation at UC Davis in California. And he wrote the book Human and Animal Medicine and coined the term One Medicine. So now we have the Lancet doing Planetary Health. One Health has been called eco-health or conservation medicine. We have groups like the World Bank getting involved in understanding the importance of One Health. So I think it's important to remember that it's not the name, it's the concept that's important. So if you're in government, you've probably heard of health in all policies or a whole government approach. That's the same idea too. It's just people getting out of their silos and working together. So the One Health initiative was started in around 2006 or 2007, and they have a ton of resources on their website. So I highly recommend this site if you want to get more information. And just so you know, when you do a search, you get so many One Health logos, and it's really interesting to see how everybody puts their own spin on it. So for example, this is Alaska University, and this is Columbia Universities. And this is Katram, this is my company, and the graphic designer I worked for understood the importance of One Health to me, so the three colors symbolize human, animal, and the environment, and connected together. And we even have a One Health Day now, so it's on November 3rd, so you can mark your calendars and have a party. So this is the classic umbrella graphic that One Health people like to use to show, to sort of demonstrate the breadth of topics. So today I'm not really going to be talking much about translational medicine, but there's a lot of interesting work being done on cancer research and genomics, where human and animal boarded people are sharing their ideas and their research. Okay, so I'm also going to go through some case examples and some things that I've seen and done in my career. And some lessons I've kind of got from that about how One Health is important. So history is important and education is key. We were sitting in a bar in New York having a drink, and one of my classmates, who was 2 months away from graduating with an MPH, was going on about the benefits of raw milk and how we shouldn't be pasteurizing at all anymore because it destroys all the nutritional benefits. And she went on for quite a while, and then I said, you do know why we pasteurize milk in the first place, right? And she just didn't. That part of history had been forgotten, because in her world, as an upper class New York City citizen, where she can get whatever she wants, she has no concept of the idea of transport issues or access and preserving food. And so I told her a story about when I worked in private practice as a veterinarian, I was in Dauphin, Manitoba, and I had a goat client, and they would milk their goats, so that's what the goats were for, just for their own home use. So I asked how they pasteurize the milk, and their response was, oh, we don't need to pasteurize this milk, it's our goats. We know where they've been, they're right here. And so, where were they? Dauphin, Manitoba is directly north of Riding Mountain National Park, which is one of 2 spots in Canada where bovine tuberculosis is still endemic. So, if the elk jump into the fence and they share some of the goat's feed, it's possible that they could get contaminated, and then that tuberculosis could be transmitted to the people. I did actually cut open a cow one time with a veterinary student with me, and it was full of nodules in the chest cavity, and I freaked out and was like, it's bovine tuberculosis. And then in the same week, we thought we had anthrax in the abattoir, and the student was like, veterinary medicine is so exciting. And I'm like, I don't think it's that exciting. But as a new grad, I don't know if the human doctors hear this phrase, but they say in veterinary medicine, if you hear hoofbeats, look for horses, not zebras. But when you're a brand new grad, you tend to look for the zebras as well. And so yeah, that elk is the reservoir. So currently my day job is with pigs, and it was an industry I didn't know anything about until I joined it a year ago, or I knew very basics about. Pig vets are very specialized nowadays. And the practice I joined used to sell antimicrobials, but they stopped, and they changed their retail space into a classroom because the pig farms these days are very big, and they have a staff, sometimes up to 20 people working in there. And so they're focusing on education and making sure that those people working in the barns understand what is the difference between a bacteria and a virus and an antibiotic and a vaccine. And why is it important to change your needles often? And why is it important to give your injection in a right place? Because they're producing our food, that bacon that we had this morning, right? We want to know that that's been produced in a safe and humane way. But one of the questions coming from public health that I would always ask them is, do you vaccinate your pigs for flu? So the pig vets in Manitoba work together really closely, and we try to share information on what strain of flu is where and doing what. I have one client that we were trying to get the flu virus isolated so we could make them an autogenous vaccine for that farm. And it was really hard. Like, I went and I swabbed the pigs, and we didn't get quite enough virus, and we had to do it again. And so all this time and money goes into developing these flu vaccines for the pigs, and they themselves are not getting their flu shots because they don't need it. They don't need the vitamins, is what some people say. They don't need, all sorts of reasons. So I like to show them this slide and explain the differences between influenza viruses and how dogs have dog flu, and we don't really have to worry about getting dog flu. We don't have the same receptors. But birds can get human flu or bird flu, and pigs can get human, bird, or pig flu. So then I show them this picture, and I say, if you have a seasonal flu, even if you don't know, and you walk into the barn and you give it to your pigs, and the pigs already have a flu virus that's circulating, then that's a high-risk situation where the virus could change and become a new pandemic, and then you guys are at the front line. And then I remind them that this happened in 2009, and it usually kind of opens some eyes. So I've also been lucky to work with some different groups, Veterinarians Without Borders in Uganda right after graduating from vet school, and Engineers Without Borders a few years ago in Kenya. And both of these groups, what I like is that their names are very specific. Like, what is a veterinarian doing with Engineers Without Borders, right? And when I did the Veterinarians Without Borders project, I was with an economist and a social scientist who specialized in women's rights and land use rights. So working together in Uganda, we would sit around and the economist would say, I have the answer. Instead of pigs, instead of goats, let's do pigs. And then I would explain why we're staying with goats. And so for the poor, having a goat is an important source of nutrition, economic stability. You can sell it if you need some extra money. And so it was interesting to work very closely with the villages and see that, and then also work with other disciplines. So with Engineers Without Borders, they were putting in a new water project, and my colleague and I did the public health assessment, so doing pre and post surveys and measuring an impact. Okay, changing ecosystems and changing health. So we've all heard about climate change and land use change. I had the opportunity to go to Brazil, Manaus, Brazil, which is in the northern part, with EcoHealth Alliance, and they do a lot of interesting work on what is the next Ebola, what will be the next SARS. And so it turns out, if you look at the world, there's global hotspots for emerging diseases, and they tend to be in areas with land use change, and increased human population, increased agriculture, and they tend to come from certain species. So primates, non-human primates, rodents, and bats. And so we were in a forest fragment in the Amazon collecting bats and then getting blood samples, and then they would screen them at Columbia University looking for the next SARS. Okay, and that's, again, because actually up to 75%, this number is a little bit off, of emerging diseases come from an animal reservoir. So whether that's arthropod, mosquito-borne or tick-borne, or rodents or bats. So who saw the movie Contagion? Okay, so I like this movie because at the very end, no spoiler alert, but it doesn't really affect the movie. I'll just say this one part, and then I won't say anything else about it. But in the very end, a bat flies over a pig pen, and that's it. And so EcoHealth Alliance collaborated a lot on this movie to keep the science sound, so that people could kind of understand, like, what goes into developing a vaccine for a new disease, what happens in an outbreak situation. So that movie was actually based on Nipah virus. And Nipah virus first emerged in about 1998 in Malaysia. And what happened was they were increasing their pig production. And so the pig farms were becoming bigger and closer together. And they also planted mango trees in the pig pens. And then the mangoes would fall down and the pigs would eat them and stuff. And they would also sell the mangoes. But the fruit bats, or the flying foxes, also liked the mangoes. So they would fly in, eat the mangoes, and their spit and saliva would get all over those mangoes and their feces and then drop down into the pig pen. Then the pigs were getting sick, and the pigs were what's called an amplifying host. So the pigs got sick, but their bodies were also really good at producing more virus. And then it was spilling over to the humans, and the humans were getting sick. So that's sort of an interesting side note on how Contagion happened. So I came back to Canada in 2014 and joined the CFIA. And one of the things that happened there was we had an outbreak of highly pathogenic avian influenza in the Fraser Valley. So when I was there, I had never been there before, and the district veterinarian took me on a tour, and we were driving around, and I was like, wow, there's all these waterways filled with migratory waterfowl, and there's a poultry barn. You can literally see barn after barn after barn. And he was like, yes, about 100 years ago, this was all a swamp and a wetland. And so he's like, hold the phone here. Like, this used to be a wetland in a migratory bird pathway, and now we've put the densest concentration of poultry farms here, and we expect to be able to eradicate or stamp out avian influenza in that it will never come back. So there's BC, in case you don't know where BC is. Hopefully everybody does. And that's us getting ready to go into the barn. I was on the destruction team and then the epidemiology team. So when we got to doing the epidemiology, we wanted to do a case control study, and we ran into a problem because we only had 11 farms. So it's pretty hard to do good stats with 11 farms. And when you take a questionnaire into a farm and you say to the farmer, do you change your boots when you go into the barn? Yes, 100% all the time. Do any wild birds ever get into the barn? No, never. Never happened in my whole entire life. But when you do a qualitative study, that qualitative study is a social science research methodology, and it lets people tell their stories. And then you take their stories and you pull out words and you develop codes and themes, and from there you can develop new recommendations. So I like this quote that not everything that can be counted counts, and not everything that counts can be counted. And it was a challenge to get the buy-in from CFIA to do this study. I'm not going to go into the results today because that's not this part, but to get them to get to do it was really interesting because they were really concerned that the farmers wouldn't want to talk to us because we're government, right? And every single farmer did, and they all wanted to be recorded, and they all wanted to have their say. So we did the questionnaire part first, and then we did the open-ended qualitative part. And the same people who were saying, you know, I always change my boots. But then in the qualitative part, well, when my son comes to help me on the sorting day, then he doesn't change his boots, right? So it only takes one person. So I just wanted to go through a bit about quant and qual. Qualitative methods for me was a big eye-opener when I got to my Master's of Public Health. So a lot of veterinarians don't know about these methods, and they don't know how to do them rigorously or how to assess the quality of the study. It's becoming more and more common, but there's more to it than just asking some people some questions and then saying what you think it is, right? You've got to be really rigorous and methodical. So the main difference, though, is that quantitative or traditional epi approach is hypothesis-driven. So we have a hypothesis, we want to find a large sample size, and we're going at a broad surface level, and we want our results to be generalizable. Whereas qualitative is hypothesis generating. You want to go in completely open-minded and just see what emerges from the data. So you're going a much smaller sample size, and you're going very deep into their lived experience. And this is tailored. So I like to describe it as quantitative is like looking at the whole forest, and what percentage of trees is this species, what percentage is diseased or dying, whereas qualitative is taking a look at one tree in great detail and looking at its root structure and what are the symbiotic bacteria and fungi that live there and all those sorts of interesting things. So I think together they're really complementary. So for that study, we came up with 19 codes and 8 subcodes, and then 11 sub-themes, and then 3 themes overall. And one of the really interesting themes was that they all understood that they were going to be living with avian influenza, that we needed to do something to prevent it ahead of time before the next outbreak. So qualitative methods are also a good way when you have a population that you want to deliver health intervention, but there's a lack of trust. So pastoralist populations live all over the world. They tend to live in marginalized land that's not very good for agriculture. They tend to be highly, highly dependent on their livestock. And so this study was done in Chad, and the problem was that the kids were dying of measles and whooping cough, and the women could only access healthcare through the men, but there was no trust of the government. So the government would come to the camps and want to do vaccination campaigns, and they would refuse. So they did a qualitative study, and what came out was, how could anybody care about the kids if they don't care about the cows? If there's no cows, then there's no kids, because then there's no food and there's no milk. So they changed the approach so that they would go in and vaccinate the cows and say, while we're here, do you mind if we vaccinate the kids as well? So they saved the cold chain, which is an important part in developing countries. You can combine the vaccines into one cold chain. And after a while, the people started to realize, like, we don't see whooping cough anymore. Now when we go to town and we come back, we don't bring measles back. And then when there was a health problem, they would proactively seek out healthcare because they had a good experience with it and they knew the value. So that's just one way that animals can help. So vaccinating the cows was the approach. So pastoralist populations, because they depend so intricately on their livestock, they are more likely to have to be exposed to zoonotic diseases. So the top 3 are brucellosis, echinococcus, and rabies. But other ones like bovine tuberculosis. At the bottom picture is a picture of the chest cavity with the tuberculous lesions, and the liver with the hydatid cysts from the echinococcus. So what can we do with the livestock to help address some of these diseases? So let's talk about brucellosis. When I look at this as a veterinarian, it's an aborted fetus. So that's too bad. The cow must be sick. I'm not going to have this calf anymore. But what about the human impacts? Because brucellosis is a zoonotic disease. It causes undulant fever in humans. It doesn't kill humans. It just makes them sick. They're more likely to miss work. It's sort of chronic and debilitating. It doesn't kill a cow either. She aborts, so she's missed a production cycle. You don't have that milk income. You don't have the calf to sell. Maybe if your social standing is tied into your livestock, you've lost some social standing. So, but neither the veterinary side or the human side really prioritize brucellosis when it doesn't really kill either one. But a case study in Mongolia found that if you vaccinate the cows for brucellosis and human health pays their share of that intervention, then it actually becomes one of the most cost-effective public health interventions, according to the World Health Organization. So a DALY is a disability-adjusted life year, and it's got a lot of problems in how they came up with those values, but basically it's a way to try to begin to measure what is the impact of a disease that doesn't kill you. So there are lots of problems in how they set it up, but it kind of gives you an idea that human health paying to vaccinate cows actually has a big payoff for the human side. So we've talked about how we can use animals as a way to get into marginalized communities with pastoralist populations, and let's bring it a bit closer to home. So who's seen the movie or read the book A Street Cat Named Bob? Okay. So this is a really nice story about a homeless guy who found this cat, and the cat sort of adopted him, and he didn't want to keep the cat, but the cat kept coming back, and finally, when he was on the streets or whatever, people would notice him and interact with him, and he had responsibility, and so he credits Bob as saving his life because he gave him a reason to live. So I also work with this group called Community Veterinary Outreach, and that is the idea of that, is that up to 20% of homeless people have pets, and they're often excluded from shelters or programs because they have this pet as well. But they're highly bonded to their pet. It's a very important part of their motivation and to avoid risky behavior. So Community Veterinary Outreach is an Ottawa-based charity, and they provide pro bono veterinary care. So a homeless person might not go to a lot of trouble to try and seek out a flu vaccine, for example, or help in stopping smoking. But if you give them an opportunity to access veterinary care, which is typically out of their reach for their pet, then they're highly motivated to attend. And once you start talking about, okay, so do you smoke, and there's effects on your pet with secondhand smoke, you can start this One Health conversation that has really good results. Okay, so people who live in poverty have a shorter life expectancy than that of the general population, so we know that. And up to 19% of homeless people and families have pets. Pets provide unconditional love without judgment. So for a lot of people, if they've become addicted to drug use, then maybe they're not in touch with their family anymore, but they still have a source of love and feeling worthy. And pets provide motivation to avoid incarceration. So who's going to take care of your pet if you're in jail, right? It's a good motivator for good behavior. And clients are highly motivated, and they want to access care. And then once vet care has been delivered, we always start with the vet care, and then they're more willing to go for oral health screenings for themselves or for their kids, to get a flu shot, to access harm reduction services. So it's been very interesting. We've just started it in Winnipeg, and we've had 4 clinics so far, and they've all gone over really, really well. So, do they engage? And I think the one interesting one on here, 54% of people want to stop smoking, right, and want to take advantage of that. And so that was really interesting. So a couple more things, just big picture ideas to get you thinking. This is from Hurricane Katrina. So people are bonded to their pets, and their pets' health and welfare affects their own. It's very stressful if you're in an emergency situation and you have to leave your pet behind. We've seen that with the wildfires and horses and dogs and all sorts of natural disasters. So I was in New York during Hurricane Sandy, and I volunteered to go around to some of the shelters. And it was a big eye-opener because, again, lots of my friends colleagues who are going to New York University have access to resources that they can go to a hotel if they need to and find dry land. But the schools that were housing the people who didn't have those resources, I just remember walking through the gym to the main office, and it was just cot after cot after cot after cot, like packed solid, and that's all the space they've got. And all of their pets were down in like 1.5 classrooms kind of thing. And it was just cages of cats and dogs and fish and turtles and birds. And it was complete mayhem. And people were donating food and animals were puking. And they had rules like you can only see your animal at this time. And you know, you've got big aggressive dogs and timid cats. So it's important when we're planning for emergency preparation that we consider the importance of animals, that they're not considered disposable by most people. The other interesting One Health connection between animals and people is the link between animal abuse and domestic violence. So at the veterinary conference here a few years ago, there was a speaker who was teaching veterinarians how to recognize signs of animal abuse that could be linked to domestic violence. So if they bring in a puppy and they say he fell down the stairs, but he's got 3 cracked ribs, you know, it's more likely that he was kicked or abused than that he actually fell down the stairs. And then that can help trigger awareness or an avenue for people to get help. So what is One Health? That was sort of a big whirlwind of lots of different topics. So One Health to me is a new way of thinking and a new language. So it's learning about disciplines that are outside of your own so that you can speak that language and communicate with your colleagues and understand what they're talking about. I really had to change the veterinary language when I went to New York to help people understand the importance of why veterinary medicine mattered, because people just only thought of dogs and cats. One of my classmates said that she didn't even know cows could get sick. And these are people who are doing global health policy where, you know, if you walk past this hut in Africa and all the chickens have died because of this disease, right? That's huge. They've lost all of their flock and their food and eggs and income. So it was really eye-opening, and then learning how to communicate that back. And it's also social justice and moral responsibility. So we have an obligation to take care of those less fortunate and to help address inequality in the world. And use our resources appropriately. We can do a lot better than what we do currently, I think, whether it's by sharing vaccine chains or just finding new ways to access communities that have been marginalized. So thank you very much, and I think we'll have questions at the end of this session.